Hello, everybody. Welcome to today's webinar. Today, we're going to talk about therapy. And there were some updates this year. Plus, we want to talk about some common things that are going on in therapy and try to help explain some of those things. So we can go ahead and we're going to get started right away. So I wanted to go over first some of the changes in the actual CPT. And so the first thing I want to talk about is low-level laser therapy. And they have put this in the constant attendance category. And you can see that it goes after the 97032, it's 97037. And it is for low-level laser therapy for postoperative pain reduction. Now, this code is in the therapy section, so we're going to need to use our GP or GO modifier if, in fact, it is done under a plan of care and therapy. And it's out of sequence, as you can see that little number sign in front of the red dot means that it is resequenced. So it's coming right after 97032. And you can also see that it's both non-thermal and non-ablative. So we're not destroying anything and we're not using any heat, but we are using a low-level laser. Okay, for all therapy services, the therapy must have a plan of care. And this is where sometimes we run into problems when providers other than therapists are looking to do therapy procedures. And we're going to talk in just on the next slide about the therapy only codes, but they have to be related to a written treatment plan. And it has to be established by either the therapist that's going to be providing the services or the physician or other qualified healthcare professional. Your plans of care must be signed and dated, and they have to have the professional's identification. So whether it's a PT, an OT, or a speech language pathologist, it needs to be documented what it is. So who they are. And that's because we can't have certain providers or qualified healthcare professionals that cannot refer to therapy. And so that needs to be clear who is the one referring. So if you want more additional information on the therapy assistance and the examples that Medicare gives as to when you have to report a modifier and when you don't, you can find it here at this link and it'll take you to that. I'm real big on links and other information so that this presentation can be helpful after today. I try to put information in here that will be a job aid for you coming up in the future. And the last thing I have is Medicare does have a booklet about outpatient rehab therapy and complying with documentation requirements. I would suggest that the therapist take a look at this and make sure that your documentation guidelines and templates, whatever you're using, are matching up to the Medicare requirements. I have the link there that'll take you directly to the booklet. They have this fancy one, and then they also have one that's printer friendly, that's black and white. It doesn't have all the pictures and whatnot on it, so you can do either one.